COVID cases are climbing in North Dakota, with today marking the 4th day of increases and the highest case count all month.
Meanwhile, vaccine rollout has slowed and some healthcare workers are concerned about the Delta variant. Reporter Maddie Beard-Temple spoke with some local public health units changing their approach to getting people vaccinated.
Maddie, what are some of the challenges ahead?
Hi, Nicholas and Brooke. The health department reports just under half the state is fully vaccinated, and those unvaccinated are hospitalized for COVID at a rate 12 times that of those with the vaccine. One local public health unit says the current approach to getting shots in arms isn't working, and it could be time to explore other options. Vaccine distribution is tapering off in North Dakota, with about 49% of the state fully vaccinated.
As with the rest of the state and the country, our numbers are starting to slow considerably.
Erin Urata is an administrator at Custer Health in Mandan, which provides services for several counties in the state. She says initial vaccine efforts worked, but now not so much.
I don't know that we've had any huge successes right now. I mean, like I said, right off the bat, we obviously did, but it has been much more challenging recently.
Urata says Custer conducted community assessments over the past few weeks to figure out why people are hesitant. A report will be coming out soon with new strategies Custer hopes to take to get more people vaccinated.
Trying to convince the rest of the people that this is what's best for our communities.
Those at Bismarck-Brilley Public Health are trying to figure that out too, but hesitancy is widespread, and Teresa Schmidt says it's important to provide people with the data.
When we see vaccine hesitancy, it's making sure that they have information from the right resources. We like to make sure that the information that is available is based on science and data.
Schmidt says Bismarck-Brilley Public Health has focused on social media, word of mouth, and community partners to encourage vaccines, but other options are on the table.
Working with other entities to post that information, whether it be the flyers, maybe potentially billboards down the road.
Those at the state health department say the efficacy of the vaccine can be seen in hospitalization data.
What we're seeing is greater than a tenfold increase in terms of hospitalizations for those who are unvaccinated compared to those who are vaccinated.
Zhao says from January to July 9th this year, there have been 707 people who were not vaccinated hospitalized for COVID-19. During that same period, 57 who had been vaccinated were hospitalized for the virus. In other words, those unvaccinated were about 12 times more likely to be hospitalized.
The numbers do speak for themselves in terms of your vaccinated populations are really doing so much better compared to the unvaxxed populations.
According to the health department's vaccine dashboard, as of Thursday, 291,422 North Dakotans have been fully vaccinated. The stats are higher, however, for those 65 and older, with about 68% fully vaccinated. And Schmidt also added that Bismarck-Brilley Public Health is seeing increased interest from younger people who might have had concerns about going back to school, sporting events, or traveling.